Services and providing penalties therefore, Senator Estrada.
Referred to the Committee on Public Order and Dangerous Drugs.
1077, an act establishing a safety internet education program in the curriculum of all elementary and secondary schools, Senator Estrada.
Referred to the Committee on Basic Education.
1078, an act addressing food security concerns through integrating instructional gardens in primary and secondary school curricula and promoting the use of urban agriculture and for other purposes, Senator Estrada.
Referred to the Committees on Agriculture, Basic Education, Ways and Means, and Finance.
1079, an act declaring July 27 of every year a special non-working holiday, amending for the purpose RA 9645, the commemoration of the founding anniversary of Iglesia ni Cristo Act, Senator Estrada.
Referred to the Committee on Constitutional Amendments and Revision of Codes.
1080, establishing the national framework of water resource management and creating the Department of Water Resources and the Water Regulatory Commission, defining their mandate, powers and functions, appropriating funds, and for other purposes, Senator Estrada.
Referred to the Committees on Public Services, Civil Service, Ways and Means, and Finance.
1081, an act enhancing the competitive selection process for power supply agreements in electric power sector, Senator Gatchalian.
Referred to the Committee on Energy.
1082, an act institutionalizing reforms in the competitive selection process of power supply agreements for the captive market of the electric power sector, Senator Gatchalian.
To the Committee on Energy.
1083, an act reducing the recoverable system loss rate and for other purposes, Senator Gatchalian.
Referred to the Committees on Energy and Public Services.
1084, an act proclaiming the first Monday of August of every year as Line Worker Appreciation Day, Senator Gatchalian.
Referred to the Committee on Energy.
1085, an act providing a national energy policy and framework for government-initiated petroleum exploration and development, further amending for the purpose Charter of the Philippine National Oil Company as amended, Senator Gatchalian.
To the Committees on Energy, Ways and Means, and Finance.
1086, an act further amending PD 87, the Oil Exploration and Development Act of 1972 as amended, Senator Gatchalian.
Referred to the Committee on Energy.
1087, an act enhancing the implementation of the net metering program, amending for the purpose RA 9513, the Renewable Energy Act of 2008, Senator Gatchalian.
Referred to the Committee on Energy.
1088, an act removing the public offering requirement of generation companies, amending for the purpose Section 43T of RA 9136, otherwise known as the Electric Power Industry Reform Act of 2001, Senator Gatchalian.
To the Committees on Energy and Public Services.
1089, an act prescribing and institutionalizing the payment by the government of the income tax of petroleum service contractors as incentive in petroleum operations and for other purposes, Senator Gatchalian.
To the Committees on Energy and Ways and Means.
1090, an act amending Republic Act number 7638, the Department of Energy Act of 1992, Senator Gatchalian.
To the Committee on Energy.
1091, an act prohibiting cross-ownership between generation companies and distribution utilities, amending for the purpose Section 45 of RA 9136, the Electric Power Industry Reform Act of 2001, Senator Gatchalian.
To the Committees on Energy and Public Services.
1092, an act lowering the optional retirement age of government employees from 60 to 56 years, amending for the purpose Section 13A of RA 8291, the Government Service Insurance System Act of 1997, Senator Gatchalian.
To the Committees on Civil Service and Government Corporations.
Senate number 1093, an act promoting entrepreneurship by establishing sustainable financing program for micro and small enterprises through the Pondo sa Pagbabago at Pag-asenso program and appropriating funds therefore, Senator Gatchalian.
To the Committees on Trade, Economic Affairs, and Finance.
1094, an act mandating and institutionalizing rollover data allocation scheme and providing penalties for non-compliance therewith, Senator Gatchalian.
Referred to the Committee on Public Services.
1095, an act prohibiting all public telecommunications entities and information and communications technology providers from imposing an expiration period on the validity of prepaid loan credits and their forfeitures, Senator Gatchalian.
Referred to the Committee on Public Services.
1096, an act promoting consumer protection and fostering competition in the telecommunications industry by mandating the unlocking of mobile wireless devices, Senator Gatchalian.
To the Committee on Trade.
1097, an act expanding the application of the Local Disaster Risk Reduction and Management Fund by amending RA 10121, the Philippine Disaster Risk Reduction and Management Act of 2010, Senator Gatchalian.
To the Committees on National Defense and Local Government.
1098, creating the Philippine Center for Disease Prevention and Control, defining its powers and functions, appropriating funds and for other purposes, Senator Gatchalian.
To the Committees on Health, Ways and Means, and Finance.
Senate number 1099, an act providing for the rights of informal ambulant vendors, Senator Gatchalian.
To the Committees on Social Justice and Local Government.
Senate number 1100, an act establishing a comprehensive, integrated, and sustainable reintegration program for overseas Filipino workers, Senator Gatchalian.
To the Committees on Migrant Workers and Finance. Majority Leader.
Thank you, Mr. President. Mr. President, there was requests from our colleagues, committee chairpersons, that they have hearings on Thursday. If they may proceed, these are, for example, Committee on Agriculture by Senator Kiko. Since he's still the chairperson, we're not replacing him. If it is all right that he could proceed with this hearing on Thursday, Mr. President.
Yes, we can do that. In fact, even if the Secretariat is saying that there might be a difference in the composition of the membership, no? But then again, a chairman and a single member
Yes, Mr.
is enough for a
Suffice
quorum,
enough to.
and that is included in our rules.
Yeah.
Therefore, they may, as long as they are the elected
Yes.
chairpersons or chairman, they may conduct hearings, even
Yes.
if the membership is at this point incomplete.
Yes, with the permission of the body, of course.
Yes, with the permission of the body.
Mr. President, I move to dispense with the reading of the journal of the 17th session, Monday, September 8th, consider the same as approved. So moved. Oh,
Mr. President.
Senator Bongo is
my
recognized.
apologies. After maybe my motion, we'll recognize the good gentleman from Davao. Mr. President,
Senator Christopher Bongo is recognized.
I just made the motion, Mr. President, on the approval of the journal and consider the same as approved. We can act on that motion first, Mr. President, and I can recognize him after.
All right. Any objection? Hearing none, the journal is approved.
Thank you, Mr. President. Mr. President, we'd like to recognize the distinguished colleague from Davao. First of all, I believe he has a manifestation to make as former chairman of the Committee on Health. And he'd also like to be, he also requests that his designation be made senior vice chair together with senior vice chair JV Ejercito.
All right. The Senator
Mr. President, we
Christopher
recognize
Bongo
the good
is
gentleman from
recognized.
Davao.
Mr. President,
Go ahead. Yes, you may proceed, please.
Mr. President, I congratulate Senator Risa Hontiveros for having been elected as the new chairperson of the Committee on Health and Demography. Nakakalungkot man po, pero ganyan talaga ang buhay. But I am ready to work with the majority as vice chairperson of the Committee on Health and part of the minority. It is an honor to have served as the chairperson of the Committee on Health and Demography for 6 years. And I thank our colleagues for entrusting to me this committee during the crucial times of our healthcare system. Ours was not an easy task. We had to address immediate concerns that came up as we were battling the COVID-19 pandemic. And I am proud that we have accomplished so much in the committee during the past 2 Congresses. Even before the pandemic, I am glad that I was able to author and sponsor Republic Act 11463 during the 18th Congress for the Malasakit Centers Act, which establishes Malasakit Centers in all DOH-run hospitals and the PGH to give convenient access to medical assistance provided by DOH, DSWD, PCSO, and PhilHealth. To date, more than 15 million patients were catered by Malasakit Centers. We also passed Republic Act 11959 or the Regional Specialty Centers Act. Nakakuha tayo ng unanimous support from our colleagues sa pagpasa ng batas na ito. Prioridad po ito ng then Senate President Mig Subiri na magkaroon po ng mga specialty centers sa buong Pilipinas. We were also able to successfully sponsor the passage of 92 laws to upgrade and establish public hospitals all over the country. We have also advocated for the establishment of super health centers across the country. Ang mga center na ito ay idinisenyo upang magbigay po ng primary health services sa ating mga kababayan, pwedeng magpa-check up o magpa-konsulta dito. Diyan na po yung PhilHealth Konsulta. Pwedeng magpa-laboratory, minor operation o mga anak dito. Layunin ng inisyatibong ito na ma-decongest po ang ating mga hospitals. In terms of health workforce, we have consistently pursued the payment of health emergency allowances to our healthcare workers who are our heroes during the pandemic. Services rendered po ito, pinagpawisan po ito ng ating mga health workers. Nagkaroon po tayo ng 15 hearings po sa Committee on Health sa 2024 at 2025. Ito pong HEA na ito, this is pursuant to Republic Act 11712 which was passed in the 18th Congress, then led by our Senate President Tito Soto. I am glad that the remaining 6.7 billion HEA will finally be paid as committed to us by DOH Secretary Herbosa and DBM Secretary Pangandaman. Hindi rin natin tinigilan ang PhilHealth. Nagkaroon tayo ng monthly hearings para tutukan ito. Nagbunga naman po ang ating pangungulit sa PhilHealth as they were able to act on some reforms. Nagpapasalamat tayo sa mga bagong benefit packages para sa dental services, optometric services, emergency outpatient benefit package. Dahil noon, kailangan nila magpa-admit ng 24 hours bago sila i-cover ng PhilHealth. At pati na rin po ang pagtaas ng case rates at improvement sa benefit packages para sa most common diseases tulad ng heart diseases. We also successfully advocated for the repeal of outdated, illogical, and anti-poor regulations such as ito pong single period of confinement policy na noon po sa loob ng 90 na araw, bawal kang i-cover muli pagka nagkasakit ka ng the-same na sakit. At ito pong 24-hour confinement policy na kailangan mo magpa-admit ng 24 hours. At ito pong 45-day benefit limit na bawal pong i-cover more than 45 days ang pasyente. Ito po yung mga anti-poor policies na dapat nilang binago noon para wala pong excess funds ang PhilHealth na wawalisin ng National Treasury. Poor Filipino patients can greatly benefit from these reforms. I will continue with my crusade for more health reforms as we seek to bring government, medical, and healthcare services closer to our people, particularly the poor. I will not waver with our commitment. I will not hesitate to help our people. I will not stop working until our people, especially the poor, have the medical and healthcare services they so deserve. My commitment to help those who are in need, those who have nothing to run to accept the government remains firm and consistent. Diseases are not partisan. Viruses and bacteria, no politics. Sickness does not care about your political color. If it hits you, whoever you are. Kung kaya mas lalo tayong magiging masigasig at magtatrabaho para bantayan ang mga reformang atin nang nagawa, katuwang ang mga ehensya ng gobyerno at mga kasamahan ko po dito sa Senado. Babantayan natin ang pangako ng executive, lalo na po sa DOH at sa PhilHealth. Magpapatuloy po ang aking adikain para sa kalusugan ng ating mamamayang Pilipino. Hindi ako nandito para sa politika. Patuloy ang serbisyo at malasakit ko sa ating kapwa Pilipino. I am here for the sick, for the struggling, for the hopeless, and the helpless. Thank you, Mr. President.
Thank you very much, Mr. President.
Majority Leader.
Thank you, Mr. President. Mr. President, I move that we adjourn session at 3 o'clock in the afternoon, Wednesday, September 10, 2025. I so move, Mr. President.
Is there any objection? There being none, the session is adjourned until 3 o'clock in the afternoon of Wednesday, September 10, 2025.